Hey everyone, it's Tony Leonardi, your certified financial planner professional from Newtown, Connecticut, back with another episode of A Smarter Way to Retire, because there really is a smarter way to retire. Today we're going to continue exploring the powerful health-wealth connection, which we actually started talking about way back in episode 19 when we had Philip Pape on as a guest from the Wits and Weights podcast talking about exercise, health, and wealth. So if you missed that one, search back in the archives for episode 19, the health-wealth connection. The health-wealth connection is how proactive health management can help protect your finances, extend your healthy lifespan, improve the quality of your retirement years, and even help to secure your legacy. To help me out with this today, we actually have a very special guest joining us. Today we have Dr. Lori Aleks. She's an audiologist with Best Life Hearing Center here in Connecticut. They have 3 offices in Connecticut. Lori was born and raised in Southern California. She earned her Bachelor and Master of Arts in Communicative Disorders from Cal State University, Long Beach, followed by her Doctorate of Audiology from the University of Florida. She practiced audiology and hearing aid dispensing in California for many years before moving to Connecticut. She's also a fellow of the American Academy of Audiology. Lori specializes in diagnosing and treating hearing loss with a passion for early intervention to prevent long-term impacts. And for those who don't already know, Lori happens to be my better half. So, hi, Lori. Thanks for joining.
Hi.
Today, I want to discuss with you how hearing health ties into retirement planning, from avoiding cognitive decline and social isolation to managing unexpected costs that could erode your savings. How's that sound?
Sounds great to me.
Okay, so let's start from the beginning. For those who might not know much about audiology, can you explain what an audiologist does and why hearing health is often overlooked until later in life?
So, an audiologist can specialize in lots of different areas. We do assess and treat hearing loss. That can be done with hearing aids. We also can assess and treat tinnitus issues. That's ringing in the ears or buzzing sounds that some people have. Also, the balance and vestibular system is something that we can specialize in. Most people end up being reactive rather than proactive when it comes to hearing loss. It's usually not on someone's radar to go and get their hearing tested when it really should be. I think when we compare it to, say, our vision, many of us end up wearing reading glasses somewhere in our 40s, and we kind of start following up with our vision care then. Often with hearing loss, people wait until the hearing loss is bad enough to where it's causing problems in their life, and then they finally seek help. So that tends to be, much later. People might be in their 60s, 70s, 80s.
So are you saying that our hearing starts to decline around the same time that our vision starts to decline? Maybe?
I think the vision tends to go first, so people start following that earlier.
Mm-hmm.
I also think, there's many doctor's offices that can do a quick vision test just to get an idea of where someone's at, but it's very rare to find a primary care physician that's going to sit you down and give you a quick hearing screening. So unfortunately, it's something that is overlooked. I think
And I guess people don't always realize that they're losing their hearing because it happens so subtly over time.
it takes many, many years for people to notice, and it's usually loved ones and friends that notice it before the actual patient notices it.
And then they're in denial.
Yeah. Yes, exactly.
And they say, no, I hear fine.
I think there's a stigma with, it's getting better, but a stigma with hearing aids. People think that's associated with the elderly.
Mm-hmm.
But I definitely think that's getting better now that everywhere we go, we see people walking around with things in their ears, AirPods,
True.
earbuds. So it's becoming less
Yep.
that, which is good.
That's fair. So what are the most common causes of hearing loss in adults, and how does it typically progress as we age?
Well, presbycusis is the loss of hearing due to aging. Just like any other organs in our body, a lot of wear and tear can cause it not to function as well as it once did. So you have presbycusis, that's aging. Hereditary factors, sometimes we'll see it in families. Patients will come in, and when we ask them about grandparents, parents, siblings, we'll see that there tends to be that. And then noise exposure, things that we do at a younger age when we think that nothing can harm us in our 20s and 30s. We can do a lot of
Like
damage
going to
to the
concerts.
auditory system, not wearing our ear protection, listening to loud music. So there's also loud noise can also cause hearing loss.
And I guess that's gradual as well. It's just the repetition of that loud noise over time, like every week when you mow the lawn.
Correct. There's that. But there's also hearing loss that can be acute. When someone leaves a concert, or maybe they were at a nightclub and it was really loud and they said, "Oh, my ears are ringing now." Anytime
Hmm.
that happens, that's a red flag that, that system is under strain. Sometimes the hearing, you can lose it in a certain area, certain frequencies due to that one time exposure. And then also, there's sometimes it can happen just over repeated exposure when we don't think we're really harming ourselves.
Okay, so what can people do to help prevent that from happening over time?
Wearing ear protection at all times, anytime you're using power tools in the garage, even if it's something you think is going to be real quick, throw on, something like what you're wearing right now, the ear protection like that, even the small little foam that is very preventative. So protect your
Well, I know
hearing.
one thing I learned from you is the Apple ear pods
Mm-hmm.
have noise cancellation.
Mm-hmm. Yeah, that's very helpful too. You can listen to a podcast, listen to you
Hmm.
at the same time that you also are taking away that loud background noise if you're on the lawnmower, something like that.
But you have to read the instructions on how that works, right? Because
Yes,
I think
so
for
neat.
months I was using it without the noise cancellation feature on. And I was just turning up the volume of the music and the podcasts to hear over the snowblower or
Now, I don't know if
the
that's more
lawnmower.
embarrassing for me or for you. I don't know.
That was embarrassing for me. I didn't read the directions. So the noise canceling does work if you read the
I just
directions.
kept saying push the button.
Right. So yeah, you have to read the directions. Here's a question that I think is important for retirees. How does untreated hearing loss impact mental health and cognitive function in retirement? I've heard you mention several times before that there is a connection between hearing loss and cognitive function.
Absolutely. There's an association for sure between hearing loss and cognitive decline. We don't know the exact connection, but there is an association. When people have hearing loss and they choose not to wear hearing aids, those people oftentimes will start to withdraw from social situations, from family functions. They'll isolate. Therefore, there's less conversation. That in itself does not help our brain. If we're not having conversations and we're not having our brains being stimulated, that can definitely lead to that. Also, living with hearing loss and not wearing hearing aids can be exhausting. When you try to get through a day and you're trying to talk to people without hearing aids when you need hearing aids, you are using a lot of the brain's resources just to try to get through that conversation. There are some researchers that believe that is pulling a lot of that brain power, if you will, that would normally go to memory and executive function, just to try to get you through being able to hear through that distorted auditory system.
So if people are withdrawing and they're not using their communication skills, are you saying that they can lose those communication skills over time?
So, there have been several research studies that have shown that when people have hearing loss and they choose not to wear hearing aids, that they have seen an increase in cognitive decline, the severity. Again, there's some conflicting research in regards to we don't know the exact connection, but it is there. Gosh, Tony, there's
It's
something else.
definitely a reduction in the quality of life, I would imagine, in retirements with hearing loss.
Absolutely. And then there is also, to take it a step further, when people wait and it gets worse. So the more severe the hearing loss is, they tend to find more that cognition issues are more apparent. So, we're talking could be dementia, Alzheimer's, just cognitive decline.
And so many people that I work with tell me that when they're planning for their retirement, they're planning for an active retirement. They want to travel, they want to spend time with family, they want to do their hobbies. How can hearing loss issues derail those plans? And what's the link to overall well being and quality of life?
Well, again, the best thing you can do if you have hearing loss is to get that treated. When you don't do that, and let's say you go on a vacation and you want to have you're on a tour, a guided tour, maybe it's even just a self-guided where you're wearing the earphones. We had a family member that had that issue not on one of our visits not too long ago, one of our trips. You're not gonna be in a happy place if you can't hear what's going on, and it can be very depressing as well, and you can become frustrated. You can start to you want other people to talk louder, and they can't, or they don't, or they forget, so that's definitely not gonna allow you to have those vacations and those times with your family the way you would like it to be. People
So if you're not
retire.
enjoying the traveling, you're not enjoying the time with your family because you're
Right,
not having good conversations,
right,
you're not going to do it as often.
right. Exactly.
It can also be understand it's very frustrating for the person with hearing loss. It can also be very frustrating for the family members. And maybe they don't enjoy it
Yeah,
as much.
it is really hard on the family. And it really
Mhm.
it's not just a one individual problem. We also
Mhm.
have to teach family members how to speak to people with hearing loss, with or without hearing aids. People always do better when you're looking at them and you're speaking clearly. And we live in a society where a lot of people have forgotten how to do that. I think it's probably because they're always on their phones, our younger
Mhm.
members.
Mhm.
But yeah, it affects the entire family. It's not just affecting that individual.
So from a family perspective, hearing loss can really affect family dynamics, like communicating with grandkids or
Yeah.
vice versa, grandkids trying to communicate with their grandparents. Maybe there's less storytelling by the grandparents and
Hmm.
less passing out of those family traditions because that communication is just broken.
Yeah, absolutely. And it's hard, when someone can't. You hear it a lot. Do you have your hearing aids on? Do you have your hearing aids on? That gets
Mhm.
hard for the person because there are people who wear hearing aids, but they still need the help of having someone look at them. So it can cause frustration on the person with the hearing loss, even if they're trying to wear hearing aids and do the right things. It can cause frustration, especially for young people. We're trying to talk to grandma and grandpa and they just aren't getting it. And then they just say, oh, forget about it. I'll just
Mhm.
talk to mom and dad instead. So, yeah, it's a shame.
Yeah, so for someone in their 50s or 60s planning for a long retirement, when should they get like a baseline hearing test and how often should they do that
I would
afterwards?
probably start at about 50. I mean, absolutely. If you have a family history of hearing loss at a younger age, do it sooner. But the best thing you can do is be proactive. You could have a hearing test at 50, and then that audiologist is going to recommend, you have no hearing loss. Why don't you come back in another 2, 3, 5 years, whatever it is that they tell you, an interval. But also, there's hearing loss that can be very, very mild. And it might be that the individual is not yet falling into a category of needing hearing aids, but audiologists now have apps that we can refer patients to that will help them train their brain how to hear in the presence of background noise. It's almost as if it's physical therapy for the brain and for the auditory system. So just because you have a hearing loss, don't be afraid to have it checked out. It could be very, very mild. It doesn't mean that you have to wear hearing aids right away. It might mean that you need to keep an eye on it. And then the audiologist might say, well, come back next year or come back in 2 years. So the audiologist can definitely give you a time frame to repeat the testing and go from there.
So for those who are a little hesitant to do that, how long does a hearing test like that take and how much does it cost? And is it covered by insurance?
Yeah. So most insurances will provide one hearing test a year. Medicare will provide a hearing test. Sometimes people have to pay a very small co-payment, an out-of-pocket cost. might be less than $20. The actual hearing test itself really only takes probably 20 to 30 minutes. We do a very thorough case history before that. We make sure that we have enough time to talk to you about the hearing loss afterwards. So, an audiologist will generally set aside maybe an hour to 90 minutes, depending on whether a patient calls and says, well, I know I have a hearing loss, so I'm going to need to talk about hearing aids. Or maybe they say, like what we're talking about, I just want to have my hearing tested. Then that might be a 45-minute appointment that we'll set aside for them.
In your experience, do you have 50-year-olds coming in and saying, I just want a baseline test? Or is that
No,
still sort of rare? It's rare.
not,
Yeah.
it's more rare for sure. A lot of, at Best Life Hearing Center, we offer what we call an event. So we might do some marketing. Maybe someone receives one of our mailers that it says, come on in, have yourself a free hearing screening. That's a good way to go too, if you want to take that first step. But
Okay. Now,
audiologists are
I
pretty
know.
nice.
Well, I know you're very nice. My question was, are audiologists scary, generally speaking? Like, should we be
Oh, I
afraid of
beat you to it.
audiologists or no?
No,
No.
no. Most
There's no one in
audiologists,
your office that's scary.
I don't think I've
You
met
don't have to
anybody.
answer that
No, no,
question.
definitely not.
Okay. I think one thing that may scare people away from seeing an audiologist is maybe the price. People hear that hearing aids and treatments can be expensive. Do you want to touch on that a little bit?
Yeah, absolutely. If hearing loss runs in your family, or if you are aware of a slight hearing loss and you're still working, oftentimes employers will offer multiple insurance plans that you can choose from. And I would say, before you retire, make sure that you get one of those plans where they might cover some of the costs for the hearing aids. Some will cover all the costs, some will cover a certain percentage. So that's always a good way to go.
So look at your plan,
I'm sorry.
your benefits.
Hmm.
Look at your plan benefits,
Yeah,
make sure
for
you have
sure.
good coverage
For
'cause that's
sure.
important to you. Have you seen people in your office, in your experience, using flexible spending accounts or health savings accounts
Yeah,
to help manage those
that is
expenses?
a great way, absolutely a great way to help cover the cost of hearing aids. Even if it's something that's down the road, I believe in, of course, you can correct me, but I believe with the savings account, health saving account, is that the HSA? The
Hmm.
people can start that at younger years in their 50s and 60s, and they may not use it till their 70s or 80s, but they have that set aside to be able to use for something like hearing aid. That's an excellent way to go, for sure.
Yeah, for sure. We actually talked in depth about health savings accounts as a great tax planning and cost management retirement planning feature. We did that, I think it was in episode 37. So if you want to go back and look at the archives and listen to episode 37 about health savings accounts, I think they're incredibly underutilized because not enough people understand them. But to be able to put money away triple tax free, tax deductible, the growth is tax
That's
free
great.
and the withdrawal is tax-free if used for medical expenses. I think people should really take more advantage of those. So listen to episode 37, Health Savings Accounts.
For sure. We do see more, I would say, of the flexible spending accounts with the folks that are still employed. But I
Hmm.
think the savings accounts, that's a great idea for anyone who's going to be coming up on retirement. Start funding that or
For sure.
get it funded. Yeah.
For sure. Yeah. Now, speaking of expense, I know there are a lot of inexpensive hearing aid options available out there. Is there a difference in quality of service and plans of how the device actually works and is cost? You should always go for something that's cheap, or should you go for something that's more quality?
We do get those questions a lot. When people go straight for something that's cheap, oftentimes it could be something that they did as a mail order.
Hmm.
I think in the way it helps the audiologist is the person recognizes, okay, this helped me, but it didn't do everything I needed it to do. Now I really need to go see a professional audiologist and get a prescriptive hearing aid. So hearing
So
aids
that's
are,
fine tuned for that person's
yes,
particular
yes.
needs. Yeah.
Hearing aids are now programmable, so they can be adjusted exactly to your individual needs. And then if your needs change, the hearing aids can be reprogrammed. But as a general rule, audiologists are going to have several levels of hearing aids, meaning different levels of technology for different needs of that individual. Someone who stays home mostly and watches TV and gets together with their family once or twice a week, they may not need as many of the bells and whistles as someone who is out and about all the time and in very challenging environments. A good audiologist is going to have different options based on your lifestyle. And then service plans, you mentioned that. A lot of audiologists will offer different types of plans. Do you want everything included? Do you want to pay as you go? There'll be different ways, different
So a
things.
hearing aid isn't just a microphone or amplifier that you're sticking in your ear. It's something that's really fine-tuned specifically,
Yeah,
or should be
yeah.
fine-tuned for
It's like having
your
miniature
specific
computers in
needs.
your ears. So they're pretty amazing. Yeah.
And they hook up to your iPhone now, and they have all kinds of apps that you can use, and
Yeah, you can
so
do
they are pretty.
streaming. We mentioned tinnitus briefly
Mhm.
earlier, which is the ringing or buzzing sounds. Oh, and that's something I will mention. That is an indicator that you should have your hearing tested. So if you have daily ringing or buzzing sounds, get your hearing tested. That's a great way to start. A lot of people will say, "Oh, well, I can't hear because this ringing is so loud." But it's really usually the opposite. Oftentimes that's a result of someone who has hearing loss. But what I was going to say is the hearing aids, not only can you stream them to your phone and listen to, it's like having AirPods on your ears. Some of them, if you have an issue with tinnitus, they even can have a tinnitus masker to help you with that as well. So they've come a long way.
Technology is amazing, and it's just
Yeah.
gonna keep getting better.
Yeah.
So
Great.
one last question for you. If you had one piece of advice that you can give to our listeners today to, connect their hearing health to a smarter, higher quality retirement, what piece of advice would you give them?
I would say to be proactive and not to be reactive. So I would say to get your hearing tested earlier, start planning for that possible expense of hearing aids down the road. I think that will prevent possibly other issues that you could have that could be much more expensive if you were to end up in a memory loss facility or having to see a neurologist all the time or having to have special care because you have dementia or Alzheimer's.
Okay, so it sounds like what you're telling me is that having a good audiologist on your team as one of the players on your team is a smart retirement move.
Absolutely. Absolutely.
All right, well, that's awesome. Thank you for your time. And for everyone listening, don't forget to plan smart, retire happier, and we'll see you next week. Thanks, Lori.
Thanks, Tony. Bye.
Securities and investment advisory services offered through Mosaic Wealth, Inc., member FINRA SIPC. Mosaic Wealth is separately owned, and other entities and/or marketing names, products, or services referenced here are independent of Mosaic Wealth. The opinions expressed herein are for general information only and is not necessarily the opinions of Mosaic Wealth or its representatives. Investing is subject to risk, including loss of principal invested. Past performance is not a guarantee of future results. No strategy can assure a profit nor protect against loss. It is not intended to provide specific advice or recommendations for any individual. Please consult your financial professional, attorney, or tax advisor with regard to your individual situation.